Good afternoon. I'm Mary Miller, a nurse manager at Community Hospital. Today I will be talking with Kate, a certified nursing assistant who is trained in the ambulation of patients with mild to severe mobility limitations. Our short interview today will focus on a patient with moderate limitations. Kate, it's a pleasure to meet you and thank you for coming.
Nice to meet you too.
Can you please explain your initial steps prior to ambulating your patient?
So initially I would report to the nurse on duty that day, and then she would assign me a patient and also give me the patient care plan. The patient care plan basically includes any information about the patient and also marks any limitations of the patient. That's important for ambulation because when we're ambulating we want to know the inhibited or weakened side of the patient so that we can monitor that throughout the ambulation process.
I see. Is there any additional information you might want to ask the nurse?
You'd also want to ask when the patient was last ambulated, and then you'd also want to know if the patient was given pain medication before this.
And why would those two factors be important to you?
This helps the CNA or nurse know the tolerance of the patient that they'll have for ambulation.
I see. Once you've gathered that information, what would you do next?
I'd continue on with my initial steps, greeting the patient and informing them of ambulation today.
Okay, and then?
Then if the patient's in a lying position, I'd help them sit up into a sitting position. This position would be known as dangling, so the patient would be at the edge of the bed and then their feet would be hanging over. This allows the CNA to look for signs of dizziness, weakness, or any pain or discomfort.
And why would you want to assess for those things?
Because you wouldn't continue on with ambulation if that was to occur.
And if they did occur, what would you do then?
You would then immediately lie the patient back down. You'd flash the call light and then stay with the patient, monitoring signs of breathing, their heart rate, and if there's any continued pain or discomfort.
Okay. And if your patient dangled well and there were no problems, what would you do next?
If they were dangling and everything was fine, you would then apply non-skid shoes, which provides for the patient's safety when ambulating, and then you'd also apply a gait belt.
Can you explain what a gait belt is and how it's used?
Sure. I have a gait belt here with me today.
Okay.
This is a gait belt. It's really nice. It allows for different size ranges, and it's pretty easy to use. You just clip it into place. You place it directly over the patient's clothing to prevent skin chafing, and then it's applied to the patient's midsection. A good rule of thumb when applying a gait belt is to place your hand in between the patient and the gait belt. This allows for comfort for the patient, but it's still enough room that the gait belt will be used appropriately.
That's a good tip. Thank you. So once you've applied the gait belt, what do you do next?
I would continue with ambulation,
Okay.
the process.
And what would that process be?
So I would, if the patient has an affected side, I would stand to that affected side, and then I'd place my hand on the side of the gait belt and then on the base underneath the gait belt, so it forms a base of support for my hands. And then I'd inform the patient that on the count of 3, we would begin standing.
I see. And you said you would place your hands on the side and at the back. Is there a particular position your hands should be in when grasping the gait belt?
It's a personal preference for me personally. I like to use underneath for the back because I think it's more support. And then for the side, it's really just whatever personal preference. You can have your hand over or under the gait belt. It's whatever you feel comfortable with.
I see. And once you have a patient in a standing position, what do you do then?
Once you have the patient in a standing position, making sure you use proper body mechanics to help them up, you then would check again for any signs of dizziness, discomfort, or weakness within the patient.
Okay, and if they have none of those?
You'd start with ambulation. You'd first inform the patient that you need to step with their affected limb, and then to follow that limb with the unaffected limb.
I see. And why would you step with the affected limb first?
Because to make sure that you have a firm, good footing for the patient and there's enough support when that first step is taken.
I see. And once you've taken that initial step?
Once you've taken that initial step, you're going to follow the patient to the side and slightly behind the affected limb and continue with ambulation. Always stepping first with the affected limb and then following next with the unaffected.
Okay. And if you were ambulating your patient and they should become fatigued, what would you do?
You'd immediately find them a chair or someplace to sit and then aid them into the sitting position, allowing them to rest.
Okay. And once you've completed ambulation, what are your next steps?
You would take the patient back to their room and assist them getting back into the bed. You make sure that they're in proper body alignment and they're comfortable on the bed. Then you'd apply you would take off the non-skid shoes and the gait belt, and then help them into bed. And then you would apply the call light, making sure that it's within reach of the patient. And then you'd also, I personally like to leave the patient with enough water within reach to the patient.
Okay.
You would lower the bed to the lowest setting, and then you'd apply the guardrails if required by the patient care plan. Once those are all set in place, you'd see if there's any pain or discomfort that the patient had from ambulation. You'd ask them if they need anything else, if they need readjustment in the bed, if they need help opening the windows or something like that. And then finally, you thank them for their services. Once that's all said and done, you go back and document your procedure. So you document that ambulation occurred today. And then finally, you would report to the nurse any findings of discomfort or pain by the patient.
I see. So if we were to ambulate a patient with moderate mobility limitations, we should, 1, assess our patient, understand their limitations. 2, utilize a safety aid device like a gait belt in that process. 3, continually assess the patient throughout the process of ambulation for safety. 4, return them to their room after ambulation and place them safely back into a bed or chair, allowing them to have a call light and anything else that they might need. And finally, and most importantly, document the ambulation and inform the nurse of any changes in the condition of the patient or how well the patient did or did not do with ambulation.
Correct.
Is that correct?
Yep.
Thank you. Thank you for your time today, Kate. It was a pleasure to meet you, and
Nice
I
to meet you
appreciate
too.
your help.